Today what we are going to be discussing is really important, and I'm sure you're going to find it very helpful for your upcoming exam, which is not so far away, right? So FMG aspirants, the X-ray cocktail. What we are going to talk about is the X-ray cocktail, and every time they ask is what is there inside it. Let's dive right into it. So what we are going to be discussing today is why I'm calling it a cocktail, because what we are going to discuss today is the chest X-rays, which have been asked over years again and again and again, and they love those chest X-rays and they keep asking those things repetitively. So you cannot afford to miss those points, because not revising and not studying the repetitive question is a straightway method how to fail. Like if you ask me how to fail, is like not doing the things which are asked quite often. So, and why am I calling it a cocktail? Because I have used USMLE books, PLAB books, a glance series, and other radiological websites which are available on the internet to kind of assess what is really important and how to make it to stay in your mind better, and how to just remember it, because there are a lot of resources and what you need is something to cling to, because a lot of resources are going to make you how to say it, confused, I guess. So what I have done is I have referred all these books for you and for myself as well, because I'm still learning. We are learning together. So let's see what is there in the video ahead for you. So let's start with first the pulmonology basics. Pulmonology X-rays are very important, be it FMG, NEET, even in next. I think in AIMS papers, in every question paper you'll see at least 2 chest X-rays. So chest X-rays are something you cannot miss. The basic anatomy, the important diagnosis, the frequently asked diseases which come as X-ray and they make up a case. So you don't even need to like read those 4 or 5 line cases if you have trained your mind well enough to read those X-ray in one glance. So what we are going to do is today I'm not going to take up too much of your time, so I have selected some of the cases which are really important. I think you should know them. So let's see what it is, but first let's see what's there in the basics. So this is the lung apex. Here you can see the trachea. This is a diagrammatic image. So next what we are going to see is a radiological image, but first we have to have a clear image in our mind that how it's going to be. So this is your trachea, superior vena cava, right hilum and right main bronchus, of course this one. Then your aortic arch will be from here, your left hilum, pulmonary artery branches, left atrium, of course, lung parenchyma, left ventricles, the costophrenic angle, this one here, and the cardiophrenic angle, this one here, is something you have to keep in mind and you can't afford to miss or confuse it either way. Okay, so next, normal adult male chest X-ray. Let's see what is there. Let's go through it quickly. The number 1 is this circular oval kind of shape, which is the spinous process. Second is your trachea. 3, look here, 3, this is the medial side and this is the lateral side, is your clavicle. Number 4 is your carina. Number 5 is your right main bronchus, and likewise number 6 is your left main bronchus. Number 7 is your right pulmonary arteries. Number 8 is likewise left pulmonary arteries. Now let's move on to 9. 9 is your upper lung zone, 10 is your middle lung zone, 11 is your lower lung zone. What is 12? 12 is your diaphragm, the dome of diaphragm, and the right side diaphragm is little higher than the left side, as you can see. If I make a dome out of it, let's see. Okay, got it. If I make a dome out of it, it's gonna be a little on the higher side than the left side, because obviously the pressure of heart is making it go a little bit down. Then what is the 13? 13 is your costophrenic angle. Where is the cardiophrenic angle? This one here is your cardiophrenic angle. What is 14? 14 is your liver. 15, you see this little blackening, this round one, this 15. 15 is your gas bubble. So here it is, stomach. If this picture would have been a dextrocardiac, which literally means right-sided heart, then your heart would be this side, the shadows will be more of the righter side. And how you'll know it? Because the diaphragm, the dome of diaphragm will be heavier this side, the right side. So it will come down below, it will come more down here, and the left side will be on the upper side, right? So that will be dextrocardia. But all dextrocardiac cases are not situs inversus, right? If you have to diagnose it as situs inversus, then this gas bubble, the number 15, right? This gas bubble will also be here, and your liver will be here, which will be obviously soft tissue, so you cannot really visualize it. But you can see your gas bubble this side, your heart being this side, your diaphragm dome being downwards, your left diaphragm dome being upwards. Yes, so that is it. That is what I wanted you to correlate with the normal anatomy. And let's discuss the important cases which I'm going to be discussing in this video. First is cardiomegaly. The heart is abnormally large. It takes up greater than 50% of the internal width of the thorax. As we can see here, the patient was known to have a left ventricular failure. So they can give you a case regarding the left ventricular failure, and they can give you this picture and ask you what it is. Next, the pulmonary edema questions. Pulmonary edema question, the heart is not enlarged, but there are signs of pulmonary shadowing from the hilar region. You can see this shadowing from the hilar region. Wing sign is very common. I'm sure you all guys know this. What I'm going to tell you is in the next slide, and that is what I'm going to focus about regarding pulmonary edema. And in the upcoming slides, there is a table where we are going to discuss the cardiogenic and non-cardiogenic reasons of it. Okay, so the patient was diabetic. They can ask you they can give you in the history that patient was diabetic and presented with acute myocardial infarction and left ventricular failure, and what do you diagnose of it? They would not mention anything about the pulmonary edema and stuff. They would give you a case like this, so be prepared. Next, curly B lines. What I want to know is the curly B lines, because it's important, and there's high chances they would ask something like that, because batwing sign is very repetitive and I think everyone knows about it. So they would ask you the same topics but something different, and maybe a little bit different things, or less asked things from it. So close-up of costophrenic angle of pulmonary edema is shown here, and here septal curly B lines are seen. You see this small horizontal is the horizontal lines are your known as curly B lines. These are the horizontal lines, as it's written here, that reach the pleural surface. They are caused by fluid between the interlobular septa and are a specific sign of pulmonary edema. Please remember curly B lines. Next is your pleural effusion, very important. How would you diagnose pleural effusion? Pleural effusion is classically given up by blunting of costophrenic angle. Look at here, there is no sharp angle available anymore. So and it's shown with the star. So the costophrenic angles are blunted. The dome of diaphragm is still visible, right? You can still see the dome of diaphragm, but the angle is blunted, which is a classical sign of pleural effusion. Next is prosthetic heart valves. They frequently ask this question nowadays. I think they like it too much maybe, and they might ask you this time as well. The heart is enlarged due to the left ventricular failure. There is evidence of previous cardiac surgery. How would you know there is evidence of previous cardiac surgery? Because look at these arrowheads. These oval things we discussed are the spinous process. But what are these? So this is a clear sign of previous cardiac surgery. And the metallic replacement of both aortic valve and mitral valve. This is your aortic valve right here, and your mitral valve is this oval one. Asbestos plaques is something important because in occupational pulmonology, occupational disorders, pulmonology is as important as anything in pulmonology. So there are multiple dense, irregular shaped opacities over both the lungs. There are typical appearances of asbestos plaques. The giveaway sign is the layering of dense material over the diaphragm. Do you see this? This is the diaphragm, dome of diaphragm, as we have discussed, dome of diaphragm. Do you see the layering over it? Like something above and above, keeping over it. So look at the arrowheads, give it some time, make an image in your brain, go till the end of the video, come back to it, watch it in 2x, 2x pe dekho, and try to answer it, right? And you will remember it for your exam. At least your short-term memory will play its game, and dhyan rahega in your exam. You'll be able to mark it if you see something like this. Next is this table. What I wanted you to know is the classical X-ray features. In cardiomegaly, what you want to see: heart shadow greater than 50% of the thoracic cage width. Done. Pulmonary edema. That's what I was going to tell you about. Can be cardiogenic and non-cardiogenic. If it's cardiogenic, then bilateral alveolar shadowing is seen. Bat swing, upper lobe blood diversion, curly A lines, curly B lines. We just discussed curly B lines. Curly A lines are like diverging lines. They are not that important, so I didn't include them in it because I didn't want to make the video really long. So curly B lines were important, so I included them. Cardiomegaly is seen, effusion, cardiac pathology signs such as we already saw, prosthetic valves, pacemaker, defibrillator, these things. So in pleural effusion, the important thing is costophrenin angle is blunted and meniscus is white out. So basically the costophrenin angle blunting is very classical and you can easily see it in the chest X-ray. Pleural plaques, peripheral pleural thickening and pleural calcific deposits. So these are the things I wanted you to know today. So what you have learned in this video is normal lung anatomy in a diagrammatic way, the normal chest X-ray, how it looks, what are the important features, the angles, the 6 most asked chest X-ray images as cases, how they twisted them into cases and ask you the simple X-rays, and one important table of features. So I have made other videos regarding other subjects as well, as a lot of people have asked me to make them on specific subjects, so you can go and check it out on my channel. The videos are available there and you can check it out on the playlist as well. I have made a playlist also where they are together, and this is my Instagram handle which you can use to contact me or text me if you have any query or if you doubt anything else, if you have any sort of query regarding FMG or anything. So thank you so much for being here. I hope this was fruitful or worth your time. I am thinking of making another episode of this because I think some things are there in chest X-ray which I want to include maybe. So just comment, like, subscribe, and let me know if you want it. Then I'll make the time to upload them. Thank you so much.